After going over Roe and Casey, I'd like to discuss Stenberg v. Carhart, discussing the partial birth abortion procedure. Now, looking at where we begin here, we're going to go through a couple of principles that the court wanted to just set right out of the gate as things that they wanted to establish and reaffirm. First, before viability, the woman has a right to choose to terminate her pregnancy. Second, a law designated to further the state's interests in fetal life, which imposes an undue burden on the woman's decision before fetal viability, is unconstitutional. Third, subsequent to viability, the state, in promoting its interest in the potentiality of human life, may, if it chooses, regulate and even prescribe abortion, except where it's necessary in appropriate medical judgment for the preservation of the life or health of the mother. So, looking at the Nebraska statute a little bit further down, this is the language that was in it. No partial birth abortion shall be performed in this state unless such procedure is necessary to save the life of the mother, whose life is endangered by physical disorder, physical illness, physical injury, including a life-endangering physical condition caused by or arising from the pregnancy itself. The statute defines partial birth abortion as an abortion procedure in which the person performing the abortion partially delivers vaginally a living unborn child before killing the unborn child and completing the delivery. It defines partially delivers vaginally a living unborn child before killing the unborn child to mean deliberately and intentionally delivering into the vagina a living unborn child or a substantial portion thereof for the purpose of performing a procedure that the person performing such a procedure knows will kill the unborn child and does kill the unborn child. The law designated this as a Class 3 felony with a prison term of up to 20 years, a fine of $25,000, and it automatically revoked the doctor's license to practice medicine. So we have Leroy Carhart, who was a Nebraska physician who performed this type of procedure and preferred the procedure, who was the subject of our case here. The first thing the court wanted to do was talk about the different types of procedures, and I like the language that it used in B, which is on my second page of the case, and it noted that our discussion may seem clinical or cold or callous to some, horrifying to others. There's no other way, however, to acquaint the reader with the technical distinctions among the different abortion methods and related factual patterns upon which the outcome of this case depends. So I'm going to go through these types of procedures. It is not a lovely discussion. I'm just going to go through them as clinically as possible, and I know it is tough reading. First is the D&C, or the vacuum aspiration. Most of the abortions performed in the U.S. are this type and are early in the pregnancy, in the first trimester. It kind of goes through and discusses how that procedure is done. And then later, 12 to 24 weeks, usually the D&E is performed, which is a dilation and evacuation. And then between 13 and 15 weeks, there's a vacuum aspiration, except surgical instruments are used to remove larger pieces of tissue because the fetus is larger at that time. It indicates because fetal tissue is fragile and easily broken, the fetus is generally not removed intact at that stage in the game. The walls of the uterus are scraped with a curette to ensure that no tissue remains, as you'll see later is an important thing because that can cause infection. After 20 weeks, parts of the D&E are involved that they dilate the cervix. They remove some of the tissue using non-vacuum instruments. And then after 15 weeks, you generally need to disarticulate the fetus to remove it to facilitate the evacuation. So the doctor will pull a portion of the tissue through the cervix, and it will pull apart as the cervix provides pressure in the other zone because it's fragile and it will just break apart. Dr. Carhart talked about how he did that, and he indicated that the D&E procedure carried some risks because as you pull those different pieces of the disarticulated fetus through the cervical canal, preparations can occur, damage to neighboring organs. Sometimes fetal tissue can be left behind, which can cause infection. generally it is still, even a D&E procedure at that time is less prone to complications than actual induction of labor. So it's still pretty safe. Then Dr. Carhart talked about the procedure that he preferred, which he called an intact D&E, or is sometimes called a DNX procedure. So first you dilate the cervix for that procedure. And then depending on the position of the baby, if the baby was head first position, then he would collapse the skull and pull the baby intact through the cervical canal. If the baby was breech, he would pull the majority of the baby through the cervical canal, collapse the skull, and remove the intact fetus. Some providers preferred always to change the position of the baby to breech first, pull the baby through, and then collapse the skull. Dr. Carhart did not necessarily always do that. The American College of Obstetrics and Gynecology described the DNX procedure basically the same way that Dr. Carhart did. Dr. Carhart indicated that he preferred the procedure late in the game because it reduced the dangers of bone fragments passing through the cervix, so there weren't as many tears and whatnot that would be a problem. It reduced the likelihood of leaving fetal tissue behind, and it also prevented fatal absorption of fetal tissue into the maternal circulation. So those were some reasons that Dr. Carhart said that procedure was preferable to the D&E procedure at that point in time. He said it was, there were also some other findings. I think the JAMA indicated that the DNX is especially useful in the presence of some fetal anomalies like hydrocephalus, where the head is really big, because it collapsed the cranium, and so that would make it easier to pull that very large, abnormally large portion through the cervix. The court indicated there's really no reliable data about how often this procedure is used, and they didn't argue that. The question before them was whether or not the Nebraska statute was unconstitutional, and they had mentioned earlier in the case that they had determined that it is. So now under A here, 2A, they're going to go through their reasoning for finding that it's unconstitutional. The first point that they bring out here is that it applies both pre-viability and post-viability. So that's kind of a problem. The arguments were much better post-viability than pre-viability because, again, pre-viability abortion can be obtained at the will of the mother with respect to any procedure. So the first interest, again, back to Roe, there are really two really good state interests that you can use here. You can do protecting the health of the mother and protecting the life of the unborn fetus, which at the different stages in the game become compelling. So the first one the state indicated was protecting human life. However, the court didn't buy that. They said the Nebraska law does not directly further the interest of the potential of human life by saving the fetus in question from destruction. It only regulates the method of performing the abortion. So Nebraska, by saying you can't use the DNX rather than a D&E procedure, is having no impact on the life of the fetus. I mean, the fetus is going to be terminated one way or the other. It's just saying you can't do it this way. Then they moved on to the health concern. And they said the courts made it clear that a state may promote but not endanger a woman's health when it regulates a method of abortion. So it's never appropriate to force a woman to choose a riskier procedure. That's not an appropriate thing that a state can do. Where the state had only a life exception rather than a health exception, they indicated that just wasn't appropriate because there has been quite a bit of evidence that they had here, some findings that the district court had found, as well as Dr. Carhart's evidence that the DNX procedure could be safer for the reasons that we discussed earlier. The DNX procedure may be the best or most appropriate procedure in a particular circumstance to save the life or preserve the health of the woman. So Nebraska had thrown out quite a few arguments. First, DNX procedure wasn't used very often. That there are safe alternatives, that it could create some special different risks, that there were no medical studies establishing the safety of the procedure, that it doesn't, nobody has